Dear students, welcome back. In the previous session, we have seen the structure of radio-ulnar joints. In this session, we are going to see the function of radio-ulnar joints. To understand the function of the radio-ulnar joint, you should know the axis of motion, range of motion, and what are the muscles which helps in a range of motion, and how these muscles are going to act on these joints to get their joint movements. Now, first we are going to see the axis of motion. So the axis of motion here, before to understand this axis of motion, what are the movements taking place in radio-ulnar joints? Or one is the supination and another one is the pronation. So on which axis this supination and pronation movements are taking place? Now coming to the axis of motion of radio-ulnar joints, the axis of motion for pronation and supination is a longitudinal axis. Here you can see this is the longitudinal axis of radio-ulnar joints. So it is the longitudinal axis extending from the center of the radial head, to the center of the ulnar head. That means it is a longitudinal axis which runs obliquely. So this axis is running obliquely from the center of the radial head to the center of the ulnar head. On this axis, the supination and pronation of the radio-ulnar joint takes place. So what are the things happening in the radio-ulnar joints movements? Okay. In supination, the radius and ulna lie parallel to each other. So this is the position. So radius and ulna are lying parallel to each other. Whereas in the pronation, what will happen? The radius crosses over the ulna. You can see here the radius crosses over the ulna. That means the radius will slide over the ulnar head. Okay. And if you see the motion of the ulna, the motion of the distal ulna is of less magnitude. That means it is not having a greater magnitude, but it is having less magnitude than that of the radius. The radius is having more magnitude when compared to the ulnar head. How this ulnar head is going to move here? Motion of the distal ulna is of less magnitude than that of the radius and opposite in direction to the motion of the radius. So if, for example, here it is crossing over the ulna here, that means it is moving in this direction, then ulna is moving in the opposite direction. Okay, so that is the thing taking place, but the magnitude is very less when compared to the radius. And the ulnar head moves distally and dorsally in pronation. So just imagine that. So how the ulna is moving during pronation. So this is the left side upper extremity. So during pronation, this is the ulna. How the ulna is moving here? The ulnar head moves. The head is moving distally. That means it is moving down as well as dorsally. So it is going like this. Okay, the head is moving distally. So that means here during pronation, what is happening? Here the head is moving distally and it is moving dorsally. So it is going backwards and it is coming downwards. The head is coming downwards, that is distally, and it is going backwards, that is dorsally. Okay, so this is the movement taking place in pronation. And coming to the supination, what is happening? The opposite movement taking place. Again, the head is coming proximally, that is the ulnar head coming proximally and then medially. So during supination it is coming again like this. So it is coming upwards and medially. Upwards and medial. Whereas in the pronation it is moving downwards and backwards. That is, the head is moving distally and dorsally. During supination, the opposite movement taking place. So it is moving downwards, so it is coming upwards. Okay, so upwards means proximally and medially. Okay, so this is the movement of the ulnar head taking place during supination and pronation. And therefore, at the distal radio-ulnar joint, the distal radio-ulnar joint, the ulnar head slides in the ulnar notch, whereas the radial notch will crosses over the ulnar head. That means what? The ulnar head slides in the ulnar notch of the radius. Okay, so how it is going to slide during supination and pronation? First we will see in pronation. The ulnar head slides in the ulnar notch of the radius from the dorsal lip, of the ulnar notch in pronation. So it starts, so this is the normal position, this is the supination. It has to come to pronation. What will happen? Here the head is sliding from the dorsal lip, of the ulnar notch in the pronation. So here it is sliding here, and the radial head is coming upwards in the pronation. Okay, in the case of supination, what will happen? The ulnar head slides from the palmar aspect of the ulnar notch in full supination. These are the things happening during supination and pronation. Okay, so what is the axis of motion? The axis of motion for pronation and supination is the longitudinal axis extending from the center of the radial head to the center of the ulnar head. On this axis, the movements called supination and pronation taking place. In the supination, both the bones lie parallel to each other, whereas in the pronation, the radial head, the radius crosses over the ulna. And how the motion of the ulna here? So the motion of the ulna is having less magnitude than that of the radius, and it is opposite in direction to the motion of the radius. Okay, that is the thing we have seen in the previous discussion. Now another important thing is going to happen to the ulna during supination and pronation. So from supination to pronation, an ulnar valgus shift is the predominant motion which is occurring, and that thing is stated by some of the studies done by Caston. Okay, what is that? From supination to pronation, there is an ulnar valgus shift. That means supination to pronation, the ulna is getting towards the body, that is a valgus shift is seen. From how much it is having is, it is an average of 5.84 degrees in 90 degrees of pronation and 90 degrees of pronation. There is an average of 5.84 degrees of valgus shift, you can see. From pronation to supination, that means from pronation to supination, what is going to happen is there is an varus shift. So this varus shift is about 8.31 degrees, which is seen in the coronal plane. We can see the ulna, which is shifting medially and laterally. So the ulna is shifting medially from supination to pronation, and it is shifting laterally from pronation to supination. So these are the things happening in the motions of the radio-ulnar joint. Okay, here you can understand the arthrokinematics of the radio-ulnar joint. Now we are going to see the range of motion of the radio-ulnar joints. So a total range of motion of 150 degrees has been evaluated to the radio-ulnar joint. How this movement can be calculated in a clinic level. It is done by this type, that is using goniometry. How the position of the patient has to be maintained here. In the clinic, the range of motion of supination and pronation is assessed with the elbow flexed. Elbow is flexed and held against the trunk in 90 degrees of flexion. That means the upper arm has to attach with the trunk here, and 90 degrees of elbow flexion has to be maintained. Why this position is required here is, this position of the elbow stabilizes the humerus. Here the upper arm is attached to the trunk. That means there is no movement is taking place at the shoulder joint. For that reason, we have to maintain this position. Then only we can get the exact movements which are taking place in the radio-ulnar joint. In any other positions other than this position, which causes simultaneous or concomitant movements in the other joints, then we will not get the exact range of motion of the elbow joint. Okay, now, so this position of the elbow stabilizes the humerus so that the radio-ulnar joint rotation can be distinguished from the rotation that is occurring at the shoulder joint. When the elbow is fully extended, for example, if the elbow is extended, and imagine that the elbow is extended here, and if you do supination and pronation, which causes rotation at the shoulder joint also. Okay, and the limitation of pronation when the elbow is extended. So though if elbow is extended, the pronation may be limited by passive extension in the biceps brachii. Okay, so this is the position you have to calculate the range of motion of the radio-ulnar joint, and you have to maintain this position, that is elbow flexed at 90 degrees with upper arm held with the trunk. Okay, and if the elbow is extended. There is a concomitant movements also taking place at the shoulder joint when you do the supination and the pronation. And the limitation of pronation when the elbow is extended may be caused by the passive tension in the biceps brachii, and the pronation in all elbow positions is limited by the bony approximations of the radius and ulna, and also the tension which are created in the dorsal radio-ulnar ligament and the posterior fibers of the medial collateral ligament of the elbow. So during pronation, in all elbow positions which are limited by the bony approximations of the radius and ulna, both at superiorly as well as the inferiorly, and by the tension in the dorsal radio-ulnar ligament and posterior fibers of the medial collateral ligaments. And when coming to supination is limited by the passive tension in the palmar radio-ulnar ligaments and the oblique cord. Here you can see this oblique cord. So oblique cord and the palmar radio-ulnar ligaments are going to limit the supination. Okay, now the quadrate ligament. The quadrate ligament limits the spin of both. So here you can have the quadrate ligament, and this quadrate ligament is going to limit the spin of the radial head in both pronation as well as in supination. And the annular ligament, so this annular ligament around the radius is to maintain stability of the proximal radio-ulnar joint by holding the radius in close approximation to the radial notch. So these are the things happening during the range of motion. Okay, so in the range of motion we have seen what is the total degree of range of motion from supination to pronation and pronation to supination, that is 150 degrees. How this range of motion can be calculated in the clinic, what is that position, and during this range of motion, if the elbow is in extension, then what are the structures are going to limit this movements, that is supination and pronation. Okay, in the next thing, what are the muscles which are going to help in this motions of radio-ulnar joint? So the primary muscles associated with the radio-ulnar joints are the Pronator Theories and the Pronator Quadratus, and the next one is the supinator and also the biceps brachii. Now we will see the Pronator Theories. The Pronator Theories has two heads. One is a humeral head and the ulnar head. So here you can see this Pronator Theories muscle. Here it is coming here like this. So it is having two heads. One is the superficial head, that is called humeral head, and the deep head, that is called as ulnar head. Okay, the humeral head comes from the common flexor origin, that is on the medial epicondyle of the humerus. The smaller deep ulnar head arises from the medial aspect of the coronoid process of the ulna, and both heads attach distally on the surface of the lateral side of the radius at its greater convexity. So the radius bone will have convexity. That greater convexity, it is almost at the middle of the radius bone. So there these two heads are going to inserted. So this is the origin and insertion of the pronator theories, which mainly helps in the pronation of the radioulnar joint. Whereas in this aspect we can see the supinator muscle also. The supinator is one of the deep extensor muscle, and the pronator quadratus is also a deeply placed muscle in the flexor compartment. So here we can see this pronator quadratus. So here we can see the supinator muscle. So first we will see the supinator muscle. The supinator muscle is a short broad muscle that arises from the lateral epicondyle. You can see here the lateral epicondyle of the humerus and the radial collateral ligament and also the annular ligament and the lateral aspect of the ulna. You can see this muscle is also getting originated from the lateral aspect of the ulna. This is the posterior view of the elbow joint. Okay. Now, so these are the origins of the supinator, which is a short broad muscle that arises from the lateral epicondyle. Some fibers are arising from the lateral epicondyle, and the radial collateral ligament, that is the ligament of the elbow joint, and the annular ligament, so which is surrounding the rim of the head of the radius, and also the lateral aspect of the ulna. So the muscle crosses the posterior aspect of the interosseous membranes. Here you can see. So the muscle is crossing the posterior aspect of the interosseous membrane to insert into the radius, just medial and inferior to the bicipital tuberosity. That means it again come in front. So it is coming somewhat anteriorly, and it is getting inserted to the upper 1/3 of the lateral surface of the radius. 1/3 of the lateral surface of the radius. So it runs somewhat anteriorly and it is getting inserted exactly at the upper 1/3 of the lateral surface of the radius. Okay, so this is the muscle which helps in the supination of the radioulnar joint. Again we will see the another deep muscle of the flexor compartment, that is the pronator quadratus. Here we can see this pronator quadratus. This pronator quadratus, so this is the pronator quadratus. The pronator quadratus is originating from a ridge on the distal 1/4 of the ulna. So it is originating from the ulna on the anterior surface. So a ridge which is present on the distal 1/4 of the anterior surface of the ulna, the pronator quadratus muscle is getting originated and it is getting inserted into the distal 1/4 of the anterior surface of the radius and into the triangular area above the ulnar notch of the radius. Okay, this is the origin and insertion of this muscle. And this pronator quadratus is also having two heads. One is the superficial and deep heads. Both of these heads arise from the ulna only, and here below this muscle again interosseous membrane is present. So these two heads crosses the interosseous membrane anteriorly and then it is inserting onto the radius. Okay, the fibers of the superficial head pass transversely across the interosseous membrane, whereas the fibers of the deep head extend obliquely across the interosseous membrane when it is going to insert on the radius. Okay, already the biceps brachii we have seen already in the previous session. Okay, so these are all the muscles which helps in the motions of the radioulnar joint, that is pronation and supination. Other muscles that are also active during supination and pronation, especially when gripping is involved, and during resisted motion. So the previous muscles, that is pronator teres, quadrator, supinator and biceps muscles, those muscles are mainly associated with the movements of the radioulnar joints in all aspects. But other muscles also active during these motions are the supination and the pronation movements, especially when the gripping is involved, and during resisted motion include the muscles are the flexor carpi ulnaris. The muscle is the flexor carpi ulnaris and extensor carpi ulnaris. Flexor carpi ulnaris, extensor carpi ulnaris, the brachioradialis. Here you can see the brachioradialis here. The brachioradialis muscle and the flexor carpi radialis. So this one, flexor carpi radialis, and also the extensor carpi radialis brevis. Extensor carpi radialis brevis. So these are the muscles also involved during supination and pronation, especially when gripping is involved and also during resisted motion. So if you observe these muscles are placed medially as well as laterally, not the muscles which are placed in between them. These are the muscles which are placed laterally and the medially are going to help in the resisted motions of this supination and pronation during activities like gripping. And also the anconeus muscle may also play a role in the supination and pronation. So these are the muscles which are involved in the motions of the radioulnar joint. Now we are going to see the muscle actions in the next session. Thank you.